We talked with Dr. Ahluwalia a little bit about this on Friday, and then over the weekend we had yet another new development, our first actual case of someone contracting or being exposed, good morning, to Ebola here, and people continue to be scared, obviously.
Right, so they're talking about a breach in protocol, and what's important to understand is that when you wear 2 layers of clothing, and you have a mask, and you have goggles, and you have 2 pairs of gloves, it's hard to take all of these things off without contaminating yourself, and it's a long process. First, you have to be washed with chlorine. Then you take each layer off without touching your own skin. And all of us, you know, as we talked about the other day, touch our face, touch our eyes. And so somewhere in this process, inadvertently, she infected herself. We don't know exactly where, but they were talking about when they were intubating him. So it was a life-saving measure.
Intubating, which is?
Which is putting a tube into the throat, right? So he was not breathing properly, and they were trying to put the tube in. And when you're trying to save somebody's life, a lot of times you skip protocols because you're in a hurry to do things, and maybe that's where it happened. But it just goes to show you how infectious this organism is, that even just by a little touch.
These are the experts.
Yeah.
Question for you.
Yes.
You're with the Cedars-Sinai group.
Yes.
What has been said? Anything yet on any particular protocol being put into?
Yes, so protocols are in place. Our emergency rooms, our personnel are aware of what to do when these patients present. But you know what's fascinating is the California Nurses Organization just gave out this huge appeal to say that they interviewed 2,000 nurses, and 85% said that they had not been communicated what to do. So
85%?
Yeah, so,
yeah, we brought that up earlier. That's alarming.
Right, so you know, we're assuming that these patients are going to present at Cedars or UCLA or USC. What if they go to a small community hospital, right? Who is in charge there? Who knows what to do? So I think awareness is really important. I think we should all have certain protocols in place so that if somebody presents, what to do.
You know that people are on the edge of panic on this one.
I understand.
Is that justifiable?
Well, I think that we all understand that this is not a run-of-the-mill cold, right? This is something that's dangerous. It's very infectious. And I think it behooves all of us to be careful and work as a society to make sure that this doesn't spread rapidly.
Right. It's also important for the media not to
overblow.
Inflame it more than it is.
Yes, absolutely. So,
yesterday there was wall-to-wall coverage. I'm sure you couldn't turn on
people are
television
still going to have the common cold. People are still going to have the flu. People are going to still have fevers and chills. But it's not Ebola all the time. So, you know, we have to
we're going to move from that to the issue of bras.
Yes.
Now, I had always heard this. I always thought it was an old wives' tale. Is it or is it not? Do bras cause breast? I don't know why I do this, but do they cause breast cancer?
So in 1991, there was a study from Europe that basically said that women who wore bras were this is only postmenopausal women, who wore bras were twice as likely to have breast cancer than not. It was a seriously flawed study, but it was the only one of its kind, and it sort of spread this word around. People started worrying. So there was a recent study from Seattle where they actually interviewed 1,500 women and asked them their habits, every single thing. What kind of bra, what cup size, underwire or not, how long do you wear it, do you wear it at night or not, you know, all of those kind of things. And they found that there is no correlation.
None. But there had been, like, whether or not there was the right type of lymphatic drainage going on, and you were being constricted if you had a bra on, so you weren't able to have those things happen the right way.
So the reason all of this came about is because there's higher rates of breast cancer in industrialized nations where we wear more bras. So that was an inherent correlation. But what they didn't look at was that we have more obesity. And obesity is directly correlated with breast cancer. So
correlated isn't necessarily cause.
Exactly. But these are all correlations. None of these are cause and effect.
But we tend to report these things, and people listen and they think, all right, this causes that.
There are very few things in medicine that are cause and effect. Most are correlations because these studies are hard to do. Where are you going to find 1,500 women who've never worn a bra? It's not going to happen. So these studies are hard to do. But what we can safely say is if you wear a bra, you're not contributing to breast cancer.
Okay.
This next study is rather. Do we have time for the next one?
I'm not sure. Booth? Yes, we do. Okay. Yes.
So someone who is using heroin knows more what to do if they OD or have people around them than if you're like on regular prescription pills, like say Vicodin, right?
So we have 5 million Americans who are addicted to prescription painkillers. The difference is it's a stigma issue. So if you're on chronic Percocet or you're on chronic Vicodin, the likelihood that your physician will counsel you about overdose is lesser. If you're a heroin addict and you go to a center where you get counseled about heroin addiction, they give you the medicine in a pack. It's called naloxone. It's available. Everybody can have it. So this is, you know, if you're taking Percocet and you overdose on Percocet, nobody around knows what to do. So this is something that's very important. Talk to your physician. If you're on some sort of a painkiller on a long-term basis, it's not difficult to have an overdose. And if you were going to overdose, somebody around you or even yourself as you sleep, you should know what to do next.
I have an odd question.
Yes.
What is more dangerous to our society at this point? Overdosing, overprescribing prescription medicine, or heroin?
We don't know the answer to that.
It's not an easy answer,
right.
is it?
I think that, you know, it's easy for us to stigmatize people who are on heroin because we think, oh, I would never do that.
And it's a cultural thing.
Right. But, you know, but painkillers, it's something that, you know, I know people who take painkillers on a regular basis. They have lower back pain or they have, you know, headaches or whatever it is.
Or their teenagers can get into the cabinet and grab it.
1 in 12 high school students are on prescription painkillers. So I think this is important for parents. I don't know the answer. No, I'm just kidding. I have no idea. But, you know, there's a certain percentage of people who are in high-stress environments who...
And we are slowly becoming more aware of this.
Right. And it's very insidious. I mean, you know, you have surgery, you have pain, and you're like, okay, you know, I'll take it for a week, 2 weeks, 6 weeks. Suddenly it's, you know, 6 months. And you realize that you're now addicted to these.
And your disease, what you have then, is not the back pain problem. It's
a whole secondary issue.
So again, for people to know, there is an antidote that's available. It's called naloxone. It should be somewhere in the house so people know that in case, you know, you overdose on painkillers, what to do.
Is that the same that they use for heroin?
Yeah.
Naloxone?
Naloxone. Also called Narcan, yeah.
Okay. All right.
Dr. A, thank you.
Very, very much. And by the way, that scene in the green
I would like to replay it.
was a little uncomfortable.
Was it uncomfortable? You shouldn't see before the camera was turned on. I'm just going to say.
Yeah, they warned us before. So.